Coronavirus coverage now. It's now in Virginia. So much is unknown about the new COVID-19 variant, Omicron, but health leaders say contact tracing could help answer a lot of questions. Alex Littlehales explains where Virginia stands with contact tracing and why it's critical for the road ahead.
Getting crucial information through the phone.
The Virginia Department of Health says that contact tracers investigate between 5 to 10 COVID cases per day. That right now, these calls are vital in staying ahead of the Omicron variant.
Where have they been? What were they doing during the exposure period? So the time frame within which we would expect them to have been potentially exposed to that virus.
Health leaders say contact tracing can provide the earliest information about a variant's impact on a community. VDH says it's in the middle of a push since the end of this summer to hire more contact tracers and case investigators as the number of Omicron cases rise across the country.
CDC did reach out to VDH and other states just to ask that, we collect really good information about these first cases in the U.S.
VDH says a recent batch of hires added an additional 200 of these positions to the state, and that Virginia is close to the highest number it's ever had, estimated at its peak around 1,500. VDH estimates about $270 million in federal funding went specifically to contact tracing efforts, just a portion of more than $1 billion allocated to the Commonwealth. If you haven't received a call yourself, it doesn't mean calls aren't being made to someone else.
People are likely to get called if they've been potentially exposed. When we have huge surges like we did last holiday season, we don't always have the capacity to be able to keep up with that.
In Norfolk, I'm Alex Littlehales for 13 News Now.
If you test positive for COVID-19 but haven't been contacted by VDH directly, health officials say it's important to notify the people you may have exposed.